Hi there, everyone. Welcome to today's information session. I'm going to give everyone a minute or so to log on and gain access, and then we will get started. Again, thank you all so much for joining us today and um, logging in. Almost there. Still have quite a few people joining us. Welcome, welcome. All right. Well, it looks like we are ready to get started. So, again, I want to welcome everyone to today's information session. My name is Tammy Trainer, and I'm super excited to be with you all this afternoon. Please note that this webinar will be recorded. So if you miss anything or need to log out before the end, we'll be sending out an email with the link to view the recording later this week. So let's start with some introductions. As I said before, my name is Tammy Trainer, and I am one of the admission counselors, Massachusetts College of Pharmacy and Health Sciences. I am currently working with applicants to the Accelerated PA program, namely students applying to the Manchester campus. And I will turn it over to Michaela.
Hello, everyone. My name is Michaela. I am also a Senior Assistant Director of Admissions over on our Worcester campus. I primarily work with our PA program on our Worcester campus. And I will go ahead and hand it over to Jamie.
Hi, everyone. Thank you so much for joining us today. My name is Jamie Hipsman, and I am the Assistant Director on the Boston campus. And I work with PA applicants, as well as a few other majors as well, both undergrad, transfer, and grad. And very excited to be here. I can also pass it over to our students that are joined here today. Haley, would you like to introduce yourself?
Hi everyone, my name is Haley. I am in the PA program on the Worcester campus, and I just completed my first semester, and I'm going into my second semester of the first year.
Hi, my name is Jansil, and I am also from the Worcester campus with the PA program. And I am also in my second semester, going into my second semester of the first year.
All right, excellent, excellent. So we are pleased to be here to talk about the university's program offerings through the School of Physician Assistant Studies. Now, during this session, we will talk a bit about the university, the different PA programs we offer, how to apply, and we'll finish up with a question and answer session. If you do have any questions, please feel free to ask them in the Q&A box, which is in the corner of your screen for us to answer after the presentation. All right, let's get started. So first of all, congratulations on your decision to pursue a career in healthcare. Healthcare is a great field to get into right now. Not only is healthcare one of the largest employers in the United States, but with an aging population, job openings are projected to increase over the next decade or so. Our students are finding job placement soon after graduation, and some even receiving job offers before they graduate. So, as future PA applicants, you probably already know that the profession has been ranked among the top healthcare careers by US News and World Report for several years running. We realize that returning to school for your master's degree will be an investment of both time and money. But based on the current job outlook, future job security, and quality of education MCPHS can provide, we believe this is a good investment of resources. All right, Did you know that MCPHS is a healthcare specific university offering 100 programs in different fields? Healthcare is our specialty, and many of our faculty have clinical sites where they work part time. Being active providers, they are up to date on the current healthcare system. Additionally, the students around you are working toward other healthcare professions as well. Through school sponsored events and other social activities, you'll learn a lot about different healthcare professions even before entering the field. Did you know that we've been around for a very long time? The university recently celebrated its 200th anniversary, starting with just a pharmacy program in Boston. We have grown quite a bit. Did you know that we are wonderful at having over 7,000 students between our three campuses and our online branch? And finally, did you know that MCPHS prides itself on maintaining clinical affiliations with some of the leading medical institutions in the nation? Some well known sites where our PA students regularly complete rotations include UMass Memorial, St. Vincent's Hospital, Southern New Hampshire Hospital, and Beth Israel in Boston, just to name a few. Right. So MCPHS definitely has a lot to offer our students, a few of which we'll touch upon on this slide. And I'm going to turn it over to our current students to talk a little bit about some of the items that you see on this slide.
Yeah, so first we have the interprofessional education. At least once per semester, students participate in an IPE activity where they engage with students in other programs. For example, this past semester, we all had to read a book, and then we had a day where um, students from other programs like physical therapy, occupational therapy, pharmacy, and other programs that we have at MCPHS. And we all sat down and spoke about how we can work together in our fields as future coworkers. And this is a great way for students to learn about other healthcare professions, how to work with patients with other from other cultures and backgrounds, and how to work as a team once employed in the healthcare system. I think that was really actually important and really interesting, especially when we had to work through and like an example in the book, and we discussed how we would work as a healthcare team to work through that, and it was really actually interesting, really nice to know how to work through that as a future provider, not only as a PA, but how to work within the healthcare system with everyone.
Yes, we also have many clubs and organizations on campus to help our students personally and academically throughout the semester. For instance, the Worcester and Manchester campus have an organization called as SAPA, which is a PA specific organization to help students specific with things specific to their program. And we also have other clubs and organizations on campus. Apart from academic piece, we also have options to join both PA specific organizations as well as cross programmatic clubs. This may be a master's program, but there are plenty of opportunities to get involved in like student government, campus activities, fundraisers, drives, and etc. For the Boston campus, instead of SAPA, we have something called as PASS. Um, we also do have CASE, which is for student can use it for like academic help wise. There are faculty advisors, peer tutoring, mentors, counseling, and career services. And CASE is basically, it stands for Center of Academic Success and Enrichment, and it helps students who may be struggling academically. The university has on-site counselors as well as peer tutors, and these peer tutors are basically second year students in the PA program that are hired by the university to help you if you need any extra assistance in a course, and these resources are free to all students. So yeah.
All right. Thank you so much, Haley and Jansel, for sharing that information with us. So, our Manchester campus is located in southern New Hampshire, just about an hour north of the city of Boston. The campus is in downtown Manchester, which is known for its New England charm with small businesses and shops, local restaurants, and historic architecture. Within a short walk or drive from the campus, students have access to parks, museums, local sports, um, historic theaters, concert venues, and so much more. We're also well placed for a quick ride into Boston, the seacoast, the lakes region, and the mountains. Manchester and the surrounding area is home to 15 colleges and universities. Our campus was established in 2002, and we have since grown to offer 4 different healthcare programs on the Manchester campus. All programs at the campus are offered year round, and most are accelerated. At around 400 students, this smaller campus makes for a more intimate, close knit atmosphere. You're not only going to know each and every one of your classmates, but you'll become close with your faculty and students from other programs quickly. This campus has a strong sense of community that will add an additional support structure that comes in useful during your busy graduate studies. Now, although our programs are very busy, studying most days of the week outside of class, our students are very involved in campus life and in the Manchester community through participation in various clubs and organizations. Which brings us to Worcester. About a 45 to 50-minute drive from Boston is where you'll find our Worcester campus. The second largest city in New England after Boston, Worcester is an area where you'll find healthcare right at your fingertips. For example, St. Vincent's Hospital is visible literally from our front steps. We have rotations there at UMass Memorial, and there are various other clinical opportunities within a 10-mile radius. This is an up and coming city that has a very rich history. NPR actually deemed Worcester the new it town in 2018 as it has become a booming hub of innovation. Once an old mill town, this area now has lots of great restaurants, sports centers, arenas, and parks. It's centrally located, allowing easy access to cities, as well as the mountains and the coast. The university has invested in the Worcester campus over the past decade to include new buildings, updated classrooms and lab facilities, and on campus housing. All programs at the Worcester campus are year round, just as in Manchester. The Worcester campus is unique as it hosts several on site clinics which serve members of the community in optometry, dental hygiene, physical therapy, and acupuncture. This campus also has graduate on campus housing options, including studio apartments, suites, and 2 to 3 bedroom condos. And last but not least, our Boston campus. Let's focus in on how wonderful our Boston campus is. Boston is located right in the heart of the Longwood medical area, just a quick walk away from prestigious healthcare facilities like Beth Israel, Deaconess Medical Center, Brigham and Women's, and Boston's Children's Hospital. Boston is the epicenter for healthcare in New England, where each day more than 46,000 employees and over 21,000 students come to work and learn. The Longwood medical area averages about 6,500 job openings annually, and 2.6 million patients are seen each year. The Boston campus primarily contains undergraduate programs, but there are still many graduate program offerings. Unlike our Worcester and Manchester campuses, most programs on the Boston campus are not accelerated. And I will now turn it over to Michaela.
All right, so I'm going to go ahead and talk a little bit about the programs themselves. So as we mentioned, we do have 2 PA programs. One of them is our regular non-accelerated program that's on our Boston campus, and then the other is the accelerated program that we offer on our Manchester, New Hampshire campus, as well as our Worcester, Massachusetts campus. So I'm going to start with the accelerated program first. So this is offered in the springtime, so it's a January start date, which is actually kind of unique because we get to it's a 2-year-long program, so it's 24 months long. So you'll graduate in December the following year, which is kind of nice because it's a time where not a lot of other programs are graduating, so you kind of have a edge in the job market, if you will, which is kind of nice for our graduates. So for the accelerated program, it's 12 months of didactic. So it's like classwork your first year, and then 12 months of your clinical rotations, which is made up of 9 5-week rotations. We will talk a little bit more about that in a little bit. For both campuses, we do have prerequisite requirements. Again, we'll list those out for you in just a bit, but we do have the seat sizes on here as well. So Worcester can house 70 seats and Manchester can house 55 seats. One thing we do like to mention here, though, is that there are no differences between the 2 campuses besides the location and the seat size. Even the acceptance rate is the same, as Worcester gets slightly more applications than Worcester, so it evens out based on the seat size. Everything else is exactly the same between the two campuses. All right, and now our Boston program. So this is a non-accelerated program. So this program starts in the fall, every September. It's a little bit different just because we get the summers off for this program. So that's why it's considered non-accelerated. That is the only difference. So for your first 2 years, you'll have 2 semesters each year of your didactic classwork, and then the summer's off. And then your 3rd year will be just like the Worcester Manchester program, where it's 9 5-week rotations right in a row. Same thing, we do have some prerequisites for this. It's going to be slightly different from our accelerated program, but we will cover that. And slight difference on the seat size here. We do have 100 seats on our Boston campus. Keep in mind, though, we do have a pre-PA track for this campus as well, though, so some of those seats are taken by undergraduates as well. All right, let's talk a little bit about clinical year. So, as I mentioned, all of our campuses have those 9 5-week rotations. These are what your rotations are going to be in. So you'll see here, you cover things like medicine, primary care, surgery, and then you do get 2 electives. You get a medicine elective as well as a general elective. And your general elective can be pretty much anything. So if you're somebody who's really into dermatology, that'd be a great time to take it. You can take it during that general elective. I do want to mention how some of our rotation process works. We can talk a little bit about that on this next slide here. So, as you can see, we have all these different areas for rotation sites. How it'll work is your didactic year before your clinical year. So if you're in the accelerated program, it'll be during your first year. If you're in the non-accelerated program, it'll be during your second year. About your 2/3 of the way through whatever year you're in, you're going to get a list of all of our rotations, all of our sites that you could choose to go to, and you're going to be asked to rank those sites. And you can put your first choice up to, I think you can go up to like 5 per rotation. And you can choose any of our rotation sites, or you can also put your own as well. If you do put your own, like let's say you went and did PA shadowing somewhere and you loved it and you want to try to go there again for a rotation, you can put that down. We can vet them for you. As long as they're qualified, we can send you there. If we can't send you to your first choice, like let's say everybody puts in for Boston Children's Hospital and they only have 5 slots open, well, then we're going to put everybody who picked that for that rotation, we're going to put you into like a lottery system and pick by random. Then once those 5 slots are full, everybody else who's remaining will move on to your next choice for that rotation site, and so on for every other rotation that you have. We do have some international rotations as well that you can apply for. They do require a separate application at that time. This is just to make sure that you qualify for it. Like, for example, we have Belize, Bolivia, and Boston has Switzerland as well. Oh, we also just added Ghana as well, excuse me. But some of the sites, like for example, may require you to speak Spanish. So obviously we need to make sure you're qualified in that kind of aspect, but otherwise, it's pretty straightforward. If you apply for it, you're probably going to get it. I know that we have 2 first-year students on here with us today. Emily, do you want to share what it was like? Anything that you would add from your rotation process when you were choosing those rotations?
Sure, yeah. So sorry, I had to join a little late. Background, I just graduated, so I did all of my clinical rotations and everything. So how it worked is it's just like Michaela said, for the Boston campus at least, it'll be second year spring semester. So in about like February is when you start preferencing. And how it worked with us is they list like, so for example, like family medicine, we have some in Boston, in Worcester. There's a couple in Florida, one in Rhode Island. So like it lists all the sites you could possibly go to. And my recommendation is just preference every single one of them. Like don't only do like your top 3, top 4, just preference them all because it's going to send you somewhere regardless. So might as well just preference in the order that you want to go in. And from my experience, I think the majority of my class got like their top 4 as far as preferencing of like where they wanted to go. I think we do have a lot of rotations in Florida, and I know like, Florida, you got to pay, you got to go. Honestly, it was probably one of my favorite rotations just because everyone was so nice. I really learned a lot. I saw like 20 patients a day. Like it was great for experience. But also like, it's just like nice during your clinicals to kind of go somewhere else because when else are you going to once you start your job, you know? So that was honestly a really good one. I think at least everyone in my program probably had 1 rotation in Florida. So if you plan on going to Boston, just be prepared for that. Honestly, best experience ever, especially if you're going during the winter months. And then I did have an international rotation. I went to Switzerland. So the application process, like when you're preferencing, you just submit like a separate application. You need to have, I think it was like 2 references. They're obviously going to look at like your transcript and your grades. For that one, there wasn't a language requirement, but I know for Belize and Bolivia, there's a language requirement. Like they prefer you to have some knowledge of Spanish. And then I do have a friend who went to Ghana for her rotation, and she loved it. So I also would recommend if you are interested in doing an international rotation, definitely apply. Switzerland, I know they only take 4 students. So if a bunch of people apply, it can be a little selective. But I think, again, it's just a great experience. Great to learn about their medicine, how they do things, compare it to how the US needs to improve. That's kind of what I took from it. So yeah, I would say clinical year and preparing for it, definitely have looked at the list of rotation sites beforehand. So you're not kind of like so overwhelmed with all the choices you can have. But I think anywhere you're sent isn't really going to be a bad thing because you're going to be experiencing medicine wherever you go. So, and that's the main thing you're there for. So, yeah.
Great. Thank you so much, Emily. And just to clarify some of those things, because I know we had a couple questions on that. Jamie, if you actually wouldn't mind just going back real quick, just because I am going to clarify something. Sorry about that. So you can see on here that these are most of our states that we have rotations in. So let's say, for example, you do for some reason put 5 preferences and we can't place you in any of them, which is not usually that common except for like maybe 1 or 2 rotations sometimes. In that case, we will try to either place you in Massachusetts or New Hampshire first. If we can't place you there, we will try to place you in the Northeast, which it can be anywhere of these states right here. And if we still couldn't do that, then we would usually talk to you. Florida's a pretty common one, or something like that. But these are generally the ones that we try to stick to. We did have a few people asking about stats. I know you can't see the typed answer, but we don't keep stats on exactly how many people are getting rotations in Boston and things like that. But for the most part, you should get like at least 4 or 5 of your rotations should be one of your choices, and then the rest of them sometimes can go a little bit deeper, and maybe we would have to place you somewhere in here to kind of clarify. All right, go ahead, Jamie. Thank you. All right, so let's go ahead and talk a little bit about direct patient care experience. We get a lot of questions about this, and we know a lot of schools kind of look at this a little bit differently, so we just want to give you some reminders here. So these are the 3 big ones. Job description and day-to-day responsibilities are more important than the job title itself. So if you're trying to figure out if we're going to count it for patient care experience, the best thing you can do is look at your job description. If you need clarification, you can send it to us and we'll tell you if it counts. I'm going to give you a list on another slide. There's another slide coming up that's going to tell you some job duties that actually tend to count, which tend to be more beneficial for students to know. Next, all patient care hours must be completed prior to applying to the PA program. We cannot accept updates and experiences or anything else on your application for that matter unless it's academic. And finally, patient care experience may not include caring for a relative or family member. That's pretty straightforward. Can't be one of those options. All right, so here's a list of those duties that I was talking about. So pretty popular ones: administer medication, drawing blood is a big one, taking vitals is another good one, but any duty that you see here will count. So jobs that kind of tend to follow these things, we have go ahead, Jamie, to the next slide. This is our list of kind of roles that tend to follow those things. There are still times that you may want to clarify, though, because there are times where a patient care assistant, for example, in some states they don't have the same qualifications as somebody in another state. So there are times that you may want to just verify that, and that's why we say that it's more important to look at the job description rather than the title, because things like that matter. The only other thing on here that is not considered like hands-on direct patient care, but we still do count it, is medical scribing. You do get to see kind of everything in that role, so we do count that as patient care experience as well. We can also accept volunteer hours for patient care experience. It just can't be hours that you received for academic credit. As long as it's outside of that, we can generally accept it. Okay, and sorry, Jamie, I also forgot to I'm going to have Jansel and Emily and Haley, if you wouldn't mind just sharing what you did about patient care experience before you applied, just to give everyone on the call a little idea of what you did, that would be great. Whoever wants to start first is fine with me.
I can go first quick. So I was in EMT during my undergrad years, like over the summer. When I went home, I would be an EMT in my hometown, and then I got a job as a patient care associate, or like a patient care tech, CNA, whatever. It means the same thing. At Brigham and Women's, and I worked on a med surge floor, primarily post-op. So that's kind of how I got my experience. My recommendation is like, as long as you have a good amount of hours, like I would say at least over 1,000. I don't know what the requirement is, honestly, off the top of my head. It's been way too long since I applied. But if you have a good amount of hours, I would say you're golden. And honestly, whatever it is you do from that big list and you check if it works, whatever gets you kind of experience is honestly best. So.
Yeah, I also worked as an EMT, like when I came home from college, in my town, and then when I graduated, I worked as an ER tech at UMass Memorial, in the trauma center. I feel like those experiences were really good, kind of talking points in my interview. So, as long as you have something that you can talk about and relate, in your interviews, I think that's a really good starting point.
I started off as a clinical research assistant in the ED, and I think that was the most trickiest to convey my hours in, because it's kind of 30% desk job and 70% patient contact. So that was in some universities it was an issue. So it's a good idea to like go ask your advisor or the admissions office if it's okay, if those hours count. And then I also was a patient care assistant. I started off as a float and then moved into cardiology, and then I also was a medical assistant. Again, I started off as a float and then moved into OBGYN.
Perfect. That is great. Thank you guys for sharing. I think that gives everyone a good idea of kind of what are good roles when you're coming in. Um, we get a lot of questions about if we require different roles as well. We don't. It is nice to see a variety if you do have the opportunity to get a variety. We do know that is hard to do though. So really focusing on the amount of experience is really important, as well as like the quality of the position. Like a lot of the roles that they just mentioned are just really high quality positions, and that's really most important. All right, I'm going to go ahead and hand it over to Jamie to start talking about our mission requirements a bit. Jamie?
Thank you, Michaela. So you'll notice that some of these are similar, but there are also some differences. So for the Boston campus, minimum GPAs that we look for overall science and prereq are 3.0. I do want to say though, our most competitive applicants have at least a 3.7. So if you really want to stand out and make yourself noticeable, I would really shoot for a higher GPA. 250 direct patient care hours are required, but I always say do more. A professor in the interview might ask you, why did you stop at 250? So the more experience, the better, especially as our students mentioned, they had different types of experiences that helped them to get into not only in PA school, but also their clinicals as well. And while PA shadowing is not required, it is recommended. And in order for that to count, you need to be shadowing a PA directly. Now for Manchester Worcester. Overall, same as Boston, 3.0 required. However, you'll notice the differences here for science and prereq. A 3.2 is recommended. Patient care hours, 200 to 500, recommended. PA shadowing, recommended. So there are some differences there, but I also want to note that just because you have these minimums does not guarantee an interview or an invitation to an interview or an acceptance. We receive thousands of applications each year, and it's impossible to interview everyone, even the most qualified. So it is fairly competitive. That's why it's important to have these hours to make you stand out. high GPAs to stand out, etc.
Just to add to that really quickly, as Jamie said, those are our minimums. We will tell you right now, though, with how competitive the program is, if you have less than 500 hours, you're probably not going to get an interview. So you should absolutely try to work for 500 to be your minimum. 250 is just the minimum it takes to apply. So we will still review your application with everything else, and we take a holistic view, so you do still have a chance. But to give yourself an actual better chance, you should absolutely try to shoot for your minimum to be 500. We would even recommend to try to have your minimum be about 1,000. The average is about 2,000 plus. So just keep that in mind. Jamie will cover the GPA averages in a little bit as well.
Yeah, I mean, that's the same thing with Boston too. Yes, we would still review your application if you hit that 250 mark, but you probably will not receive an interview. Our most competitive applicants definitely have thousands of patient care hours. So thank you for highlighting that. Now for the prereqs. So again, some slight differences here. For example, you'll notice that for the Boston campus, Bio 1 with lab is required, while it's not for Manchester Worcester. A&P 1 and 2 are required. Microbio is required for both campuses with lab. 3 semesters of chemistry, so one of these has to be an upper level course. This could be biochemistry, and 1 lab is required as well. So that could be a Chem 1 lab, a Chem 2 lab. But we would typically take the highest grade earned for those courses. Stats and psychology, both are required for these programs. Now, you'll notice for Manchester Worcester, biochemistry is required, orgochemistry required. So although those could be used for the Boston campus as prereqs or those upper level courses or for lab grades, Manchester Worcester, they are absolutely required. All right, when it comes down to applying, you will be given the option to apply to Boston, Manchester, Worcester. CASPA may allow you to apply to more than one, and you will be paying for more than one, but we will reach out to you and say, which one do you want? So apply to the one that you want. So if it's Manchester, just submit that with CASPA. The CASPA is now open. So for those that are looking for fall 2027 entry on the Boston campus, you can apply now. And Manchester Worcester, as we said earlier, it's a spring start, so that would be for spring 2028. All official transcripts are required from colleges attended. So even if you did a semester at a community college to get your stats grade done, we would need that. So any college that you've attended, we need those official transcripts. 3 letters of recommendation are also required. We typically like to see maybe someone from where you gained your patient care hours, whether that was a supervisor, a colleague, maybe the PA that you shadowed, but also one of your professors. That way we can see who you are as a student and then who you are as an employee. So that way that can speak to different sides of you. For those that have international transcripts, we do need a WES or ECE evaluation to convert the grades to US grades. And for those that English is not their first language, we need an English language exam on file. So whether that's TOEFL, IELTS, Duolingo, that will be needed to be submitted. All right, so now for the prereq grades. The classes cannot be older than 10 years. There is a limit on math and science courses specifically, and you cannot have below a C. So a couple C's are fine, but ideally we're looking for a C or higher. Not a C minus, but a C or higher. And you can only apply with max 2 courses outstanding. So if you're in your final semester now, or maybe you just need to get intro to psych done, that's fine. But no more than 2. When we look for a GPA, we look for the cumulative, science and prereq. We also look for progress. Maybe you had a rough first semester, but as long as you turned that around and then got maybe A's and B's throughout, that's definitely something we would consider. Experiences, interest, motivation in your essay. Why do you want to be a PA? Why are you interested in MCPHS? And also the timing of the application. Since we're reviewing these pretty much as they come in, the earlier the better would be ideal. All right. For those that are eligible for an interview, you will be notified via email. Just to give you an idea, Boston, we typically have these interviews August through November, and Manchester, Worcester, we typically have them October through February or March. Typically, what you can expect is an overview of the program, a presentation. You'll get to meet some faculty of the PA program as well as alumni. There is a student panel, and then the admissions office would go over next steps with you, meaning when you're expected to receive a decision, which usually is around the holidays for the Boston campus. Michaela or Tammy, when ideally would those decisions go out after an interview for Worcester, Manchester?
For Worcester, Manchester, we send them out in batches. So generally, historically, we send out a batch in December, and then we send out a batch in March as we host interviews from generally the end of September, beginning of October until March.
Great, thank you. Now, the interview sounds pretty scary. Haley, Jansa, Emily, do you want to go over what your interview day was like or any tips that helped you prepare?
Yeah, I can talk about my interview day. I think one of the reasons actually I chose MCPHS because of my interview. I think that was the most I felt comfortable with so like talking to one of the faculty out of all of my PA interviews through the process. I I think when we first got on, it was on Zoom, and it was a group of us, and then we had an intro. I think it was by Michaela or Hannah Campbell, and they spoke about the school more in detail. And I think there was 2 students. I can't remember. It was a while ago, but so we had that, and then we split out in breakout rooms, and I spoke with one of the faculty for I think it was like 30 minutes, and then you come back, and that was the whole interview. I feel like it's really, it's very nerve wracking, obviously, but I feel like I felt very comfortable, and um, it was easier to speak about my experience and really just get to know the faculty and like have them get to know me. Um, and I think going into the interview, honestly, just practicing as much as you can. It's kind of hard to prepare, but as long as you can draw from your experience, from your um, patient care experience, and in school, and they want you to be able to like reflect and also show that um, even though you are a student, even like beyond a student, you are a human and you have other interests. So, showing that you are, there's more to you than just, your application. I think that is something that like they want to see, and that makes a good applicant.
I think Haley summed it up really well. But yes, the interviewers already know that you're very nervous and already super scared. So I think they really do try to go out of their way and make you feel comfortable during the interview. And that's what I really liked about it too, because it felt more like a conversation than an interview. And I think again, it's very difficult to see the soft skills on like an application. So this interview is just to see who you are as a person and what you can bring to the table, and just talk more about yourself that wasn't really, translated well in your application. Maybe just share your experiences as a person. So that's a good opportunity for the interview.
So I agree with everything that they both said. It definitely did feel more like a conversation to me, which is part of the reason why I chose, to pursue my degree at MCPHS. But also it just made me feel very comfortable. My advice would be definitely like was mentioned before, try to practice as much as you can. Try to definitely come up with like a list of questions you can ask them too, because always asking questions is a good way to show that you're very interested in the university, asking, um, is there a lot of resources for students? How involved is the faculty? Asking, is it more of a collaborative or competitive environment with your students? Those are kind of some of the questions that I asked. Um, and definitely just be yourself. Don't put on a front. Don't pretend to be someone you're not. If you're yourself, they're going to see that. I definitely fumbled over my words and I still got in. So don't sweat it too much. Just be yourself. Try not to stress, which ironic I said that because I was like almost gonna cry before mine because I was so nervous. But like genuinely, it was a very easy process. I think now they're on campus for the Boston campus, I believe. I had mine over Zoom 3 years ago, so I know that's changed since then. I think they're on campus now. So it's also a nice time. You'll get a tour of the school, I believe. Great place to see like the facility. So yeah, definitely enjoy your interview day as much as possible. Ask questions, be engaged, and you'll be fine.
Yes, thank you for mentioning that, Emily. For Boston, they are back to being on campus. So that's definitely a huge perk is seeing the campus, especially if you're traveling from far away. This is your opportunity to see what it's like to be in Boston.
And we are still virtual for Worcester, Manchester. I know there was a question about that, so just wanted to add that too.
So these are some common questions that we get that I haven't been looking at the chat. It's possible some of these questions were asked there. So let's just go over these. What is the average GPA of incoming students? So Boston, we're looking for a 3.67 overall and in prereq and 3.6 in science. And then for Manchester, Worcester, 3.62 overall, 3.59 science, 3.7 prereq. I would say definitely try to shoot for these, if not higher, to make yourself a competitive applicant. Is there a supplemental application? No, supplemental questions are all included within the CASPA. Do you have rolling admission? Yes, we do. That's why it's important to submit your application earlier, the better. Do you require any standardized tests? So we get this question a lot, whether it's the MCAT, the GRE. No, we do not require them. In fact, if you submit them, we will not review them. So only submit them through CASPA if a school that you're applying to requires them, because we won't review them. Does patient care experience from another country count? Yes, as long as those skills that we had mentioned earlier, the job description matches what we're looking for, then yes, it does absolutely count. Can prereqs be completed online or at a community college? Yep, as long as the college is regionally accredited, which most community colleges are, that's perfectly fine. And if you're not sure, you can always look on the school's website just to make sure that they are accredited. What counts towards my shadowing hours? I mentioned this earlier, but it's only in-person shadowing hours with a PA. Can I update my application after submission? No, your application will not be, will be reviewed as it is upon submission, except for any academic updates. So if you are in progress for a course, then yeah, we'll update that. But patient care hours, for example, we won't be able to update that. Do you accept AP credit for prereq coursework? We do. But in order for us to do that, you need to have a 4 or a 5 in order for the course to be counted toward a prereq. AP scores may only count towards 1, 3, or 4 credit prereq course. So for example, AP Bio, that will only count for Gen Bio 1 with lab. My GPA falls below your minimum requirement. Will I still be considered? Unfortunately not. We do receive thousands of applications each cycle. So if you do not meet those GPA requirements, the shadowing, which was recommended, but if you want to include that, patient care hours, if you don't meet those, unfortunately, you will not be considered. Here is all of our contact information. So if anyone needs anything at all, please feel free to reach out. These are our email addresses and phone numbers. You can also check out the website at mcphs.edu/visit. We also upload YouTube videos, and my recommendation, honestly, is to look for the PA students that talk about their clinical placements, their rotations. You'll really learn a lot from them. Even if they're maybe a couple years old, the information's still the same because we still have those clinical affiliations with all the hospitals in the area, as well as other sites nationwide. That was all we had.
Yeah, let's go ahead and flip it over to asking some of our remaining questions that we have here. There's a couple good questions in here, I think, that a lot of students are wondering, so we can go ahead and answer those live. The first one is, what should I consider when deciding which campus to apply to if you feel that you could apply to any one of them? As Jamie mentioned, you do have to pick which campus to apply to. When you're deciding between the 3 campuses, 2 things are the most important thing. One, how well you feel you will do academically in an accelerated program versus a non-accelerated program. So if you're somebody who you feel like you value the time a little bit more and you want to take your time to do these sorts of classes and you feel that you may not do so well in an accelerated program, you may want to go towards Boston. If you feel like you're somebody who can handle that and you're somebody who wants to get it done a little bit sooner and you know that you have some time to do it a little bit more rigorously, then you could go for the accelerated program. Alongside that, it just comes down to the location. If you're somebody who likes more of a quiet setting, you may go to Manchester, for example, because it's a little bit more tight-knit. It's still in the city, but it's much quieter than, say, Worcester or Boston. Or if you're looking for a big city feel, you may go towards Boston, because obviously that is a very well-known city. There's a lot going around. Or if you're looking for a little bit of in between, you may go to Worcester because there's, it's in a big part of the city, but there's also a lot of spots that are pretty quiet. So it really just comes down to what you prefer for that. A lot of students also base it on the prerequisites that they have too, or like how well you're doing. So like if you have none of the chemistry requirements or no A&P 1 and 2, you may look at Boston because they have biology and they're a little bit more flexible in the chemistries. Or if you don't have the biologies, but you have all the A&Ps and you've already taken chemistry courses, you may go towards Worcester, Manchester. So things like that is what it really comes down to. Would you add anything else to that, Jamie? I think that pretty much sums it up.
That's pretty good.
Sounds good.
You hit all the points.
Awesome. All right, so next, is there any suggestion for minimum shadowing hours to adhere to this recommendation? So shadowing is really great to have on your application, so we would absolutely recommend getting shadowing, and it does have to be specifically from a PA. I believe the average is between about 25 to 50 hours of shadowing. So if you can get into that range, that's great. I think that's pretty straightforward. 25 hours of shadowing isn't too much. If you do 2 12-hour shifts, you're already pretty much there. So anything like that. We had the same question about volunteer hours and things like that. Patient care hours and Shadowing hours are the only things that I would say are necessarily have an average. Besides that, the volunteer hours, the research hours, any other hours that may be on there. It is great to have on there because we absolutely take that into consideration for like our holistic view. So if we like if you were in between being interviewed and not being interviewed, something like having a great amount of volunteer experience could be something that we're like, oh, you know what? They really did a lot of work here and this shows that they're really dedicated. Let's give them a shot. Something like that. So definitely the more the better. I always say if you have an experience and you're not sure if it counts, just put it on there. It can't hurt you, so just put it on there. All right, let's see. Someone's wondering about the faculty and about if there's any that are in the program themselves and things like that. So we love our faculty. We do have some faculties that went through the program themselves and are now, faculty members in the program. I know for Worcester, Manchester, and Jamie, maybe you can add a little bit about Boston after this. I know for Worcester, Manchester, all of our faculty members specialize in something different, which is really great. I believe that they try to have the same variety on Boston as well. Jamie, is that right? Yeah, okay. Yeah, so a lot of our faculty members specialize in something different, which for obvious reasons is super beneficial going into a program like this because we provide great access to these faculty members. So if you were taking an anatomy lecture and you specifically wanted to talk to Dr. Stoll because he's the one that specialized in that, you could do that. And we keep that open for that reason. We want you to be able to talk to people who are, experts in their field. So we certainly have a lot of that.
Yes,
Jamie?
us as well. They're all practicing clinicians, so although they are teaching courses here, they are also still in the field. So they have that hands-on experience that they can bring to their classrooms as well. It's pretty exciting actually because you do have the most up-to-date information, what's going on in the PA world. Maybe they have connections at a hospital you want to work at or a clinical, they can help you find that. We also have clinical advisors to help you with that, but just having that extra connection helps as well.
Absolutely, yeah. All right, we only have a couple more minutes here, and we like to stay pretty punctual on this because we don't want to hold anybody up. But if we don't, I'm going to try to go as fast as I can through these next couple questions to get through as many as possible. If we have any remaining or you want any clarifying questions, please send it to us in an email and we'll be happy to answer. We can also share it with our students and have them give us a response as well, so feel free to do that. All right, so if you retook a prerequisite that you had a C- in, would we average the two grades? We're going to look at 3 different GPAs, your overall, your science, and your prerequisite GPA. When it comes to your overall and your science GPA, we will have to take both grades. When it comes to your prerequisite GPA, we will take the higher of the two. Okay. For the accelerated program, someone's wondering if the classes are longer and things like that based on the fact that we're accelerated. So Boston has slightly longer semesters than we do. I think that it's like an additional 2 weeks maybe than ours is. So that kind of plays out into it. But for the most part, it's our accelerated program is pretty rigorous. So it is like more compact into your week with information. So that's kind of what evens it out a little bit. Based on like the time that we have off as for our accelerated program as well as our Boston program, it kind of evens out just based on that. It's really just the 2 semesters. And since we have 3 semesters in the accelerated program per year, it really evens out pretty evenly. But it is definitely a little bit more rigorous.
Yeah, just quickly to add to that, the really only difference is Boston, you're not in school in the summer unless it's your clinical year later on, whereas Worcester, Manchester, you are. So like Michaela just said, it kind of evens out in the end, but that's really the only difference. One has summer semesters, one doesn't.
Exactly. Thank you, Jamie. Okay. Some of these questions are a little bit more specific to you personally, so if they are, I'm going to skip it for now and just ask a little bit more of a general question. For housing, we do have housing on our Worcester campus. We do for it's just graduates on our Worcester campus, so you do have housing there. Manchester does not have housing, but we do have off-campus housing options that we will help you find. Boston does have housing, but it does give priority to their undergraduates. So just keep that in mind as well. For your clinical year, you are responsible for finding your own housing and for paying for it. However, we do have clinical leaders that will help you to find things if you're struggling and things like that. All right, I'm going to go ahead and end it right there. I know we still have a lot in the chat, so please, if you do have questions remaining, please email them to us because we would be happy to answer them. And we just want to thank everyone for being here today. There were some really good questions in the chat, and we would love to continue to do so. So thank you all for being here. Thank you to our students. Haley, Jansel, I know Emily had to hop off, but thank you so much for being here today. And like I said, feel free to send us over those questions. We can connect you with one of our students if you would like as well, and then we can finish answering those. But thank you so much for joining us today. We hope you have a good rest of your week.
Thank you.
Bye.